Well, a warm welcome to today's talk. It's Friday, the 2nd of July, Friday evening. Now, a bit of an update from the UK. Some interesting work from the Office for National Statistics showing the likelihood of reinfection and the likelihood of disease in a secondary infection with COVID-19. Not related to the vaccines, just related to reinfection. And the news there is looking fairly promising, I think. And then we'll look at some news from the United States and Europe as time allows. I want to start off with some orientation slides first of all, just a couple of them here. So Australia, we're keeping an eye on that at the moment. It's on a bit of a knife edge. Things really could go either way in Australia with this Delta variant. It is a worry, and we've expressed frustration that Australia has been so slow on the vaccine rollout. Canada cases are going down. Now, the United States cases are up about 10% on the last week. So they are going up in the United States, largely due to the Delta variant. Not entirely. Ireland, as with Europe, slight increase in cases in Ireland. But of course, South Africa and the United Kingdom, unfortunately, leading the pack at the moment. Now, big difference actually between South Africa and the United Kingdom. The United Kingdom, the vaccination rate is high, so these cases will transpose into few people getting ill. We hope, we're pretty sure about that. Fewer hospitalisations and thankfully fewer deaths. South Africa, where the vaccination rate is low and they're heading into winter, which of course is worse anyway, it's going to transpose, these cases are going to transpose into a much higher percentage of poorly people, hospitalisations and deaths. So I'm afraid South Africa, the third wave that it's entering into now, is going to be worse than the previous two. That is the way South Africa is shaping up, unfortunately. Let's hope the vaccination programme there can be picked up really, really dramatically, although not too much signs of that happening anytime soon. So I'm a bit concerned about South Africa. Of course, we'll be keeping an eye on it. So kind of tailor two countries there, really. UK, not so worried. South Africa, really quite concerned. Look at Europe later on as well. Definite increase in cases in Europe, largely Delta variant driven, as we know. United Kingdom, as we can see, the cases are already high and are still increasing, unfortunately. Now let's look at some information from the Office for National Statistics. Now, just briefly on prevalence, first of all. Of course, Office for National Statistics, always slightly out of date. Week ended the 26th of June. England, the prevalence was 1 in 260 people in that week. Wales 1 in 450, but Northern Ireland 1 in 670, so Northern Ireland's better. Scotland, unfortunately, not so good with 1 in 150 people, 0.68% of the population infected in that week. This increase, of course, but of course we know about this. This is not new. This is the trend, unfortunately, we've been watching for some time. Just to confirm that, now if you look on the Office for National Statistics site, of course you get this for all of the 4 home countries, but here we see this is the old-fashioned Alpha variant, the Kent variant, and this is the Delta variant first identified in India. So we can see that's down to about 0.05, that's about 0.32, so way higher. So this is about 95 or more % of the infections are now Alpha variant. Are now Delta variant, with the Alpha variant much lower. And we can see here that the Delta variant was lower on the 16th of May, overtook on about the 25th of May, and since then the Delta variant has just been becoming more and more prevalent in terms of percentage of positive cases. And this is an attribute of the virus variant itself and will be repeated in other countries. You can just see this. This is just happening. Now, Office for National Statistics, COVID-19 reinfections, as of the 29th of June, so it's collected on quite a bit of detail, based on the National COVID-19 Infection Survey conducted by the Office for National Statistics, which is large and thorough. Now, I remember way back in February, March 2020, wondering about the risk of reinfections. And of course, we know now people can be reinfected. But this is showing the level of protection that an initial natural infection gives, and it's fairly promising. And the other thing is, I'm remain optimistic about the longevity of natural infection protection, the immunity generated by natural infection, and the longevity of immunity generated by vaccines. Now, we'll see that's not a universal opinion later on, but it's still, I still hold that, and I'm still optimistic about that. And so far, the data is consistent with that thinking I've had for some time now. But anyway, going on to natural reinfection. Now, Office for National Statistics, very precise, of course. They define what second infection is. It's a new positive test 90 days or more after an initial first positive test. So this is based on testing, which is good. Or it's a new positive test following 4 consecutive negative tests. So 2 ways to demonstrate reinfection. Now, Office for National Statistics say this is rare, and they say that secondary infections are milder than the original infections. And we know from the COVID symptom tracker data that there's typically fewer infections, although we know the infection symptom pattern has changed, as we've looked at before, much more likely to be headache, runny nose, sore throat, coryzal, sort of common cold type symptoms. But as the COVID symptom tracker data showed, that they're not that common after vaccination, and they're milder. And now the Office for National Statistics is showing the same pattern after natural infection and natural immunity. So rate of asymptomatic in first and second infection. Now, this did surprise me a bit. Reinfections, of course, less likely to report symptoms. In other words, reinfections more likely to be asymptomatic. Now, first infection, basically they were saying only 21.8% of people were asymptomatic, but second infection it was 57.1% of people that were asymptomatic. I must say the rate of asymptomatic in the first infection lower than I thought, but that is based on the national survey, so that is now the data that we have. But the key thing is that it's illustrating there is if people are reinfected, they're much more likely to be asymptomatic with their second infection than they are with their first infection. And also the viral load is likely to be lower. Now, this is measured by the cycle threshold, which we've looked at this before, but the strength of reinfection is measured by a cycle threshold, a CT value. So what happens is you take your antigen swab, you take the test, you run it through the PCR test, and that doubles the amount of viral particles every time it does a cycle threshold till it gets to nicely detectable levels. So what this means is if it takes fewer cycles to get to detectable levels, there's a higher viral load there to begin with. If it takes more cycles to get to a detectable level, that means there is a lower viral load there to begin with. And I've kept it writing this down so we get it the right way round. So positive results with a low CT value, the positive results with a low CT value of 30 or less. So this is episodes of infection with a higher viral load because it takes less cycle thresholds to recognise that the virus is present. And these patients are more likely to be ill with a higher viral load, and with a higher viral load they're also more likely to be excreting more of the virus and therefore more likely to be infectious. So that kind of makes sense, and Office for National Statistics are confirming that. Now, positive results with a high CT value, that's 30 or more, that indicates a lower viral load, less likely to be ill, less likely to be infectious. And we know that people who are reinfected have lower viral loads and are more likely to be asymptomatic. People with first infections are more likely to be symptomatic and have a higher viral load. I think I got all that the right way around. Right, now, so initial infections, most people have a low CT value, higher viral load. Reinfections, high CT value, indicating a lower viral load. And it's good to have that confirmed by the Office for National Statistics. So in other words, can you catch the infection off someone who's got an initial infection? Yes, it's quite likely, especially with this Delta variant, unfortunately. Can you catch an infection off someone who's been reinfected? Yes, but because they're likely to have a lower viral load, because that's been indicated by a higher CT value, they're likely to be less infectious, so the probability of you getting it is less. That is what that is saying. Now, before we go on, I'm going to look at the United States in a minute, but I just was thinking about this concept of a CT threshold. I just came across a rather interesting study about CT threshold. So that's the study there if you're interested. Now, this was 678 hospitalised patients. Now, those that had a CT value of 25 or less, in other words, they had a high viral load, in hospitalised patients, I'm afraid 35% of those died. So the higher viral load associated with a greater chance of dying. Those with CT values of 25 to 30 median viral load, their mortality was 17%. But those with CT values above 30, i.e. with a low viral load, so CT values high above 30 with a low viral load, their mortality was much less. So we see a direct link there between the mortality rates and the higher viral loads in hospitalised patients. And patients with higher viral loads, lower CT values. And we believe exactly the same will be true in terms of infectivity. Higher viral loads, more infection. So that was pretty convincing data there. Clear relationship between viral load as measured by CT value and patients' risk of dying in patients that were already hospitalised. Now, I'll show you one more thing on this. I think this is from the offer. I sort of debated as to whether to show you this or not, but I think you can probably cope. If I can, you most certainly can. Let's have a look at it. Now, the Office for National Statistics, they come up with some amazing graphics. So here we have, what we have here is, this is lower viral load towards this end and higher viral load towards this end. So the higher viral loads, lower CT value, the lower viral loads, higher cycle threshold values. So lower viral load, higher viral load. So what we see with initial infections is the greens are asymptomatics. So this is the distribution of viral load in initial infection. And we notice there's not a completely clear correlation there between the symptomatics and the asymptomatics. Slightly more symptomatics with a higher viral load, yes, but some symptomatics with very low viral load in initial infection. Quite interesting. But reinfection, we see this cluster way down here at the lower viral load, with very few patients up here with a higher viral load. But we notice there's nothing like a one-to-one correlation between being symptomatic and viral load. So I thought that was a really quite I'd actually never seen a graphic quite like that before. So I thought that one was really pretty clever, so I thought I'd show it to you. And anyway, the reference for that is on the Office for National Statistics site that we looked at. Now, moving on to the United States, let's have a quick look at the data from the States here. So infections were actually up about 10% on the week. Unfortunately, on the 7-day rolling average, this is always a bit out of date, of course, but the 7-day rolling average from the CDC data is 9.1%. I think it wasn't, 9.1% higher this 7 days than the 7 days previous to that. So as we've been expecting for some time, infections are starting to increase in the States. So slight increase in infections in the States. Still nothing like it was, of course. And if we look at deaths in the States, they are continuing to go down, which is good news. But if the cases continue to go up because of the relatively large number of people unvaccinated in many parts of the States, deaths will go up towards the end of summer and into the fall, into the autumn time. I'm afraid that is probably what is going to be happening in the States, because we know the vaccination program's continuing, but not as quick, and it's patchy. This is the thing. So the United States cases up 9.1% on the past 7 days. First time there's been an increase for quite some time. 25% of these new cases are Delta variant. Now, in the States, we have variants of interest, variants of concern, variants of high consequence. And of course, the Delta variant is still in the variant of concern category. Thankfully, we have no variants of high consequence. Let's hope we never do, because that would be bad, because they're variants of high consequence. Right, adults with at least one dose of vaccine. Now, Alabama, it's about 49 to 50%. Adults with at least one dose. Wyoming, only 50, way below the national average. Virgin Isles 49, Louisiana 48, Mississippi trailing up the rear in the United States at 46% of adults with at least one dose. The Delta variant will increase fairly quickly in these states. The Delta variant will become the most prevalent variant in the United States over time. But these are the states at risk, the lowest vaccinated states. And remember, that's adults with at least one dose, so doubly vaccinated going to be way less than that. And we know that 2 doses of the vaccine are needed to get any significant benefit from protection against the Delta variant. If you've only had 1 dose of the Pfizer vaccine, for example, your protection against the Delta variant from symptomatic infection is only about 35%, bunking up to about 88% if you've had 2 doses. And of course, even if these states start vaccinating like Billy-O now, there's going to be a bit of a delay because it takes 3 weeks after the second dose. Now, the correlation between the 1,000 worst counties where 30% of adults have got 1 dose or less and the increase in cases is greater. So there's a clear correlation between the 1,000 counties with the lowest uptake of adults being vaccinated and the highest increase of infections. So check out the CDC data. So a pretty clear pattern emerging in the states of the well vaccinated and the, well, what we can only say poorly vaccinated area. And it's not through shortage of supply. If this was in South Africa, they would be queuing up round the block for these vaccines. Absolutely. In virtually everywhere else in the world, that would be the case, actually. So really, unvaccinated friends that you have in the States, I think you know the best thing to do for them to increase their probability of survival and wellness, to reduce their chances of morbidity and mortality. Now, briefly, we'll do a bit on Europe. So things, as we said, going up in Europe. It's been going down for 10 weeks. It's just started going up now. WHO, Hans Klug in Europe. New wave of the WHO European region unless we remain disciplined, but it's already happening. Social mixing is increasing. Travel is increasing. Easing of restrictions is increasing. Delta variant is increasing. Spain, it's in the unvaccinated younger people. Russia, the deaths are going much higher. That was 48 hours ago. I'm not sure what the last 24 was. UK cases, 27,125. The last 24 hours. 24 hours before that, 26,000. It's going up in the UK really quite dramatically. In fact, we'll just have a look at that now, I think. Here we see the UK. So the vaccination numbers are going well, so that's good. But if we look at cases, if we have the technology, well, no question. I mean, this really does constitute a third wave in terms of cases. But as we've said, because of the vaccination rates in the UK, healthcare admissions to hospital up a bit, yes, which we would expect. Total number of people in hospital up a little bit, but nothing like as much as they would be without the uncoupling between the cases and the hospitalisations as a result of the vaccination. And likewise, deaths in the UK, I mean, it's still 116 people in the week, but that's mercifully low compared to what it has been. So we might see a small increase in deaths in the UK, but we are really hoping it's going to be small. All adults over the age of 18 need to report for vaccination in the UK as soon as possible. The vaccines are there. Go and get them. Now, this applies to everywhere, really, but this idea that we're going to have a sort of a Liberation Day on the 19th of July in the UK, it really is. I've been thinking about this, and it really is simplistic. I was just thinking, this is such a simplistic idea. Nothing is going to change between the 18th and the 19th and the 20th of July. It's just a date. And I was thinking about this, and then I heard David Nabarro talking about it. Now, Dr. David Nabarro, in my view, should immediately be appointed head of the World Health Organization. He's been a medical doctor all his life, highly qualified, highly experienced. As a highly experienced teacher, he just knows what he's talking about. Pity he's not in charge, I think, but there you go, that's where we're at. But anyway, David Nabarro has said this. We do have to be prepared for the inevitability that viruses will continue to be a problem for us. So it's not going to go away all of a sudden, according to Dr. Nabarro. We're going to have to really seriously contemplate continuing to practice some degree of physical distancing, some degree of mask wearing, some degree of hygiene. So this idea of Liberation Day, where all of a sudden the clock ticks over from midnight to a minute past midnight and everything goes back to normal, is naive and simplistic. And Dr. Nabarro is saying that's not the way it works. Some degree of protecting those who are most at risk, as long as there are these nasty viruses around, whether or not we're vaccinated. So in contrast, really, it has to be said, Dr. Nabarro is in contrast here to what the Centres for Disease Control is saying, where what you're allowed to do depends on your vaccination status. David Nabarro is saying, no, we need to have some low-cost, ongoing interventions. It makes people very angry because they want to be able to stop being careful, but it's my advice. And it's just based on studying these things over many years. I mean, quite a few years, you're longer than me. But of course, specialising in this sort of field, is that it's not a cool thing to ditch our preventative measures on a particular date because we hope that's going to be associated with less risk. The risks are going to stay. So it's ludicrously simplistic to say that we have a Freedom Day. It's much more of a political statement, and we'll take Dr. Nabarro's medical statement as being more accurate. So, just final news on the couple of maybe things on the UK. UK vaccine boosters in autumn. Interesting. It looks like the government are planning for it. All adults over 50, NHS and care staff, anyone who qualifies for a flu jab, will probably be offered a third dose in autumn. Professor Anthony Harding, Joint Committee on Vaccination and Immunisation, we're worried about people who have had their vaccine earlier on. We want to make sure they have a booster in time for winter. We do know from other vaccines that immunity wanes quicker in older people than younger people. So he seems concerned here that the immunity is going to wane and we're going to need a booster, because if you had a vaccine like 6 months ago, you're going to need another one now because the immunity is dying down. Well, I see no data that is the case. I really don't see any data that is the case. I actually think I don't think he's right on this. Now, if of course immunity does start to decline, then sure, we're going to need a booster dose. Now, having said that, with the new variants, and of course these booster doses are not going to be a new variant tweaked vaccine, they're going to be an old type vaccine, probably an mRNA vaccine for the booster doses, or maybe a protein-based virus vaccine potentially. I think that's the Novavax one, isn't it? I think. But the additional vaccination, even though it's with vaccines that were designed for the original wild type virus, if you have another dose of that will increase your immunity to the new variants. Even though these are not going to be tweaked vaccines that are going to be ready for this autumn. So I think his fear there that immunity is going to wane by autumn is unfounded. But if he's thinking that a third dose of the vaccine will give even additional immunity over that which we're going to retain, in my view, then that's fair enough. And this seems to be the way that Russia's going as well. They seem to be going for an annual booster in Russia, which I thought was interesting. Now, just briefly, we can't cover everywhere, of course, but Africa is a concern as well. It really is quite a concern. So Uganda, population 45 million. President Museveni, public holiday last Friday for the nation to pray for relief from the pandemic. Getting about 20,000 cases a day. And this is with virtually, well, I can't say virtually no testing, but massively limited testing. They've had about 2 million infections, increased holiday travel, and they have the Delta variant. Deaths, 126. No, most aren't recorded. President Museveni said that actually in his talk. He said most deaths aren't recorded. They've gone into a 42-day lockdown, restrictions on movement, roadblocks at district borders. COVID relief funds were mismanaged last year, meaning a lot of poor people, like Bangladesh, are really going to suffer during that is one heck of a long lockdown. So as in Bangladesh, the real fear is people are going to go hungry as a result of this. In Kampala, in Uganda, of course, lack of beds, lack of oxygen equipment, lack of PPE, lack of gloves, lack of ambulances, and basically lack of everything. We used to sometimes send students to, I won't mention particular African countries, but basically we always told them to take boxes of their own gloves just for their own personal protection. They just weren't available. This is the sort of minimal financing level that many of these hospitals run on, unfortunately. Medical fees in Uganda are high. Uganda's private hospital, cash down payments of $3,000 need to get in. Way, way, way beyond the average annual salary of most people. AstraZeneca, remember the country is 45 million and they've had, 1.5% of the population with one dose, 834,000, not enough. Africa's got 1.3 billion people overall, 18% of the world's population, 2% of the vaccine doses. You know, we really need to reflect on this, don't we? But not for too long, because we need to act on it pretty quick. Other parts of the world, Indonesia, population 270 million, Java and Bali are locked down for 2 weeks, limited testing outside Jakarta. And again, we see increasing cases. So some parts of the world with good vaccination rates doing well. Ironic that people in Indonesia and Uganda are absolutely desperate for vaccines and are queuing round the clock if they get the chance of a vaccine, whereas in other parts of the world people are not taking up the vaccines that are available. So maybe a few things to reflect on there. Nothing we haven't talked about before: global inequality, fairness, or the lack thereof. Things to think about. Anyway, that's some interesting information there. So basically good news on reinfection. And of course, we believe that the immunity generated by the vaccine is even better than the immunity generated by natural infection. And we've looked at the fact that people that are vaccinated are much safer. Symptomatic disease is going to be less. Symptoms are less for less duration. So there we go. That's us for today. A bit longer than I intended, but if you've stayed to the end, thank you for staying to the end, and thank you for watching.